Dr. John Segreti is the medical director for infection control and prevention at Rush Medical College in Chicago, and he is joining us tonight. Doctor, we appreciate your time. Let's start with the pills and some of the concerns. What's the top line for you? What do you want people at home to know?
Well, the main thing is that these are drugs that will hopefully decrease morbidity in terms of decreasing severe illness, prevent hospitalization, and prevent death. And we are seeing a lot more people in the hospital now, and a lot of them are not vaccinated. And many of the people in the intensive care unit and people that are dying are almost all unvaccinated. So hopefully this will be another layer of protection in addition to vaccination.
I want to talk to you about the evolution of this virus. Will it continue to mutate? And I'm guessing yes, because it has so far. But is there a way to predict future variants and how it will break apart?
Yeah, almost certainly it will continue to mutate, because that's what happens as viruses replicate. They make little mistakes in their genetic code, and those are mutations. And some mutations are good for the virus, some are bad for the virus. And if you get a mutation or a series of mutations that make it better able to replicate and better able to infect people, that's the variant, or that's the mutation that'll stick.
Let me jump in real quick, but I'm wondering, can you predict it? Like, is there a sequencing that happens that you can look into a crystal ball and determine what we can expect?
No, it's impossible to do that. We look at the flu virus, and there are little changes every year, and we have trouble predicting which strain of influenza will be circulating the following year. So it's really very difficult to know what kinds of mutations will make the virus more fit and better able to infect people.
It's fortunate that Omicron seems to come with some very mild symptoms for most people. What happens when a more serious variant emerges? Are we prepared for that?
Well, we're not as prepared as we should be. Our public health infrastructure isn't as strong as it should be. It certainly is better. Our healthcare system needs to be able to surge to take care of sicker people, and we've been able to do that, but at great cost to our healthcare workers. And it's something that requires a lot more planning and a lot more money. And unfortunately, once this goes away or decreases, people forget about it. Just a few months ago, people forgot about coronavirus and COVID because we weren't seeing that much. Now that we're seeing more, all of a sudden, it's like coronavirus and COVID have been rediscovered.
And here we are again going into winter with cases going up, and the hospital system already saying it is strained. Dr. Segreti, appreciate your insight tonight. Thank you.
Thank you.
Thanks for watching. Click the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.